Condoms are made for a reason.
Every year would be okay.
I'd rather prefer someone else would tell me beforehand that they have STD.
If I have sex once without using a condom, I cannot get infected.
I don't think that's true because, condoms are made for a reason. They just don't protect you from getting pregnant, but also from unsanitary intercourse or anything like that.
No, you can get infected.
STD can be passed in any sexual contact. The chances of transmission are greatly reduced with a condom, but even a condom is not perfect at preventing transmission of STDs.
I've only slept with one partner and I cannot have an STD.
Of course you can.
If you're active with a lot of people, sometimes at the same time, maybe at different times, you never know what the other person might have, and it's always best to be safe than to be sorry.
So probably not, but otherwise, no.
So some people think if I don't have a lot of sexual partners, then I'm not at risk, and that's not exactly true. Certainly, the more people that you have sexual contact with, the more chances you have of becoming exposed, but it only takes one person and it only takes one time or one episode of sexual contact or intercourse. If that person has an STD and you have sexual contact with them, you've been exposed. And so it doesn't take lots of partners in order to be exposed. It does increase risk, but it still can only happen with just one time.
Can you live a healthy life, full life with STDs, STIs?
You can't live a full, healthy life because you do have a disease. It means you're not fully healthy.
You can, but you also need a constant treatment because otherwise you can't be sexually active because you also need to let other people know.
AIDS and HIV, I feel like yes, you can't live a full life because you have this illness within you, and it's a lot of money to support yourself with that kind of illness, and not a lot of people can afford that, so you can pass away early in your life.
Unfortunately, STDs are very common, and so there are a lot of people who have had STDs, who've been treated for STDs, and who have been able to move on with their life and still live healthy, full lives without an impact on their fertility. So if you've been diagnosed for an STD and been treated, you can still have a normal, healthy life. Some STDs do stick around and stay with you, viruses specifically. So HSV, herpes simplex virus is there. Once it's there for life. And it can be treated, and you can have your immune system figure it out and keep it suppressed. You can use antivirals to keep it suppressed and not pass it on from there, but it can still always pop up later on. HPV, human papillomavirus, the same thing. You can have an infection when you're young, and it can pop up 10, 20, 30 years later with an abnormal pap smear. HIV is another one that is a virus that can stick around, so you can be infected with HIV. And fortunately, there are very good treatments for HIV today and antivirals that suppress it. And most people who are diagnosed with HIV today are actually able to suppress it enough that they never go on and develop AIDS. But it requires lifelong treatment. And people who have STDs, the viral ones specifically, can go on and still have a normal, healthy sexual life without having to worry about infecting their partners, because there are suppression treatments to keep the risk of transmission very low.
If my partner pulls out, I will not get an STD, STI.
Well, it's not no sense. You still can get it. Yeah.
No, you still can get an STD because you already had a penetration.
No, that's still not true, because you will get an STD in the first contact. The first contact matters the most, and it doesn't matter when you pull out or how you do it.
So it is important to know how STDs are and are not transmitted and are or are not prevented. So like we talked about, condoms can greatly reduce the risk of STD transmission. Another method that people have used or thought would work in the past is to pull out, and that does not prevent STD transmission. Sexual contact puts you at risk for an STD if your partner has an STD. Condoms reduce that risk. Pulling out may reduce that risk if there's not ejaculate inside the woman, but that does not eliminate the risk at all.
Birth control pills will protect me from getting an STD.
Oh, I don't know much about that, but I can say that it just messes with your hormones, doesn't cure anything.
No, I don't think that birth control pills protect you from STD. They protect you from getting pregnant, but not from sexually transmitted diseases.
No, not at all. I don't think so, no.
Yeah, so a good question of will birth control pills protect you from an STD? And the short answer is no. Birth control pills do not protect against STDs. They only protect against pregnancy. And so they provide no barrier for transmitting, that's giving an STD, or contracting, that's getting an STD from a partner during sexual contact.
I know someone with HIV and I don't want to get HIV by drinking after him, her.
I don't think you can get HIV when you drink from the same glass, or even if you, I don't know, if you're somehow get in contact with this person, unless it's not like sexual contact.
No, you can only get HIV through blood. If the other person's blood would get in your circular system.
Oh, I'm not sure about that.
So with HIV, it's important to know how it can and cannot be transmitted. HIV is transmitted through blood or sexual contact. And so sharing a glass with somebody who has HIV does not put you at risk of contracting it. Kissing somebody with HIV does not put you at risk. It's sexual contact or contact with blood, blood transfusions, sharing of needles like IV drug users, for example. The risk of transmission in blood transfusions is extremely low because it's something that's screened for. So living with or around someone with HIV is not a risk for you without either of those two circumstances.
Chlamydia and gonorrhea are not serious STIs and will go away with time, so we don't need to treat it actually.
You definitely do need to treat them because, I mean, I haven't had it, but I know people, they feel uncomfortable when they get those diseases and they definitely should be treated.
No, both diseases still need treatment as any other disease.
No, I don't. That's not true. I feel like it's a lifelong sickness.
So gonorrhea and chlamydia are two of the more common STDs that we find. They can be serious. Gonorrhea and chlamydia both can cause long-term problems. They can cause serious pelvic infections that can require hospitalization and can even be fatal in some cases. Gonorrhea and chlamydia more often can actually cause scar tissue inside of the uterus, the fallopian tubes, and the abdomen and pelvis, which can cause problems like chronic pain or even infertility in the future. So they definitely should be treated. They can go away on their own sometimes without being treated, and so some women may not be treated and not have a lot of symptoms and still develop long-term complications like the scarring inside.
Like you can tell when someone has an STD, STI.
No. Usually, people who have those kind of illnesses, they tend to look the same as other people.
I can't tell. I'd rather prefer someone else would tell me beforehand that they have STD.
How? I don't think if there's visual symptoms.
It can be difficult to know whether or not you or someone else has an STD. Some STDs come with a lot of symptoms very early and very obvious, and some don't have symptoms at all or have symptoms that can mimic other diseases or other problems as well. So you can never be 100% sure that somebody you're having sexual contact with does not have any STDs. Some common symptoms that you may notice of STDs for women is abnormal vaginal discharge, either with odor or with pain or itching or burning, bleeding in between periods or change in periods, pelvic pain, cramping, abdominal pain, pain with intercourse, fever, chills, nausea, vomiting, sudden onset of any of these symptoms could come from STDs.
How often should you get tested for an STD, STIs?
If you're sexually active, I feel like being tested every half a year is nice, but a lot of people not do it. So every year would be okay.
I would say it depends on how sexually active you are. If you have many sexual partners, I would say as often as possible.
Well, I feel like if you're not sexually active, that there's kind of no point. Maybe just to be sure, because who knows. But if you are sexually active, I feel like once a year, that's so good.
Certainly if you have a new sexual partner or known contact with an STD or suspicion, you should see a provider and be tested for STDs. It's recommended that women under age 25 be screened for STDs every year at an annual exam, starting with initiation of sexual activity, which is regardless of age. So there's not an age to it, but as soon as you become sexually active, you should be screened at least once a year, or again, if you have any known contact, suspicion of contact, or new sexual partner.
Can you engage in sexual activity while infected with AIDS or HIV?
If it's through a condom, maybe, but I don't know. I wouldn't, honestly.
If you want so.
I think it's not safe for the other partner because you can pass it on, especially because that's how it's passed, how you get it, how you got it in the first place. And I don't think that it's possible until especially if it's not fully treatable, like you have it forever. I don't think it's safe to do it, at least for other people.
Yeah. So if you have HIV, you do have the risk of passing that on. That's based on the level of the virus within your system. And so the larger amount of virus within your body, the higher the chance of transmitting or giving that virus to someone else is. The lower that volume of virus is, the lower the risk. Certainly other things protect, like condoms, do make that less likely as well. And so it is possible, and a lot of people around the world have HIV, are on treatment to suppress, keep the numbers very low, use condoms as well, and are able to have sexual intercourse without passing on that virus. So they are able to still have sexual activity without a fear of transmitting HIV.
How you felt talking about STD, STI, or is this topic that you would not like to talk about publicly, or how you felt?
To be honest, when I moved here, it was a weird topic for me because I moved from Ukraine and it's not really something people discuss or learn in school. It's just what your parents tell you, kind of. And here, we learn it in school, our teachers explained it to us in sex education, and I was weirded out. So, and kind of now, I see that it's an open topic here, and I think it's really good because I learn more and more about it, so I can prevent it.
I think it was a little bit uncomfortable, but yeah, I think it's still important to talk about it, just to let other people know that that's not something that you can't ask about or that you have no one to talk to about.
No, I can say people have sex with other people, and it's a normal thing to talk about it and not making it a taboo, because the more people acknowledge the topic and the more people know about it, the less cases where somebody gets AIDS or STD happen. So it's a good thing. Yeah.
So we've talked about STDs today, and while there is no 100% way to prevent STDs other than abstinence, there are things that you can do to protect yourself. What's important is that you practice safe sexual practices, and that if you have symptoms or known exposure, or you suspect that you may have been exposed to an STD, it's important that you contact your health provider and get tested. You can find more information about STDs and how to prevent them on the Oregon Health Authority website on their STD page, or at endhivoregon.org.